myself such time as I may consume.
The gentlewoman is recognized.
Thank you. Madam Speaker, the new fiscal year starts in less than 36 hours, and Congress has still not passed the annual appropriations bills. If we don't do it, the government will shut down. During the last shutdown, we lost $24 billion and 120,000 private sector jobs. I'm sure we could expect just the same now. The debt ceiling will need to be raised within the next couple of months, Madam Speaker, and many Republicans are already threatening to refuse to perform even that basic task. This would throw the international economy into chaos. It would cause the loss of tens of thousands more jobs in the United States. And of course, the EXIM Bank expired in June, and our business communities are clamoring for reauthorization. Why? Well, last year, the EXIM Bank financed deals that supported 164,000 American jobs. I would suggest, Madam Speaker, that the U.S. House should spend this week figuring out how to avoid a political and financial catastrophe, rather than, once again, passing a blatantly political bill stripping women of their basic health care rights. This latest attack targets both the women who need to see a doctor or health care provider as well as the providers themselves. The bill on the floor today, I wonder if the people on the other side of the aisle actually read this bill, because it is so broadly written that it would target any medical provider, doctor, hospital, clinic, you name it, that has even the most tenuous connection to the provision of a full range of women's health care services. The majority claims that this bill targets Planned Parenthood, a health care provider that 2.7 million Americans rely on every year. Well, first of all, over 90% of the services provided by that agency are routine wellness exams, like breast exams, cervical cancer screening, and birth control and family planning services. And as we all know, because we discussed it ad nauseum last week, Planned Parenthood receives no federal funding for abortions. In fact, no agency receives federal funding for abortions, with a very few exceptions. This bill would therefore not stop any government funding of abortions. It would instead allow federal and state funding to be cut off for any entity, not just Planned Parenthood, which performs abortions with private dollars. That means that poor women would be blocked from the full range of health care services that they need, not just at Planned Parenthood, but at their local hospital, or their local clinic, or the offices of another women's health group. Let's call this bill what it is. It's an attempt to eliminate health care services for women across the board, using the Planned Parenthood witch hunt as an excuse. And let's be very clear. The investigation of the last few months has demonstrated that the videotapes the majority so heavily relies on are heavily edited, manipulated, and at times downright misleading. We are the U.S. Congress, Madam Speaker, and we are better than that. The American public will not stand for this diversion, and neither should we. Let's defeat this ill-conceived bill. Let's direct all of our collective attention to bipartisan solutions resolving the looming fiscal disaster that we are all facing. I reserve the balance of my time.
The gentlewoman from Colorado reserves. The chair recognizes the gentleman from Pennsylvania.